Welcome to MedQuiz, where medical education meets professionalism. In this video, we'll discuss the pharmacology of new DNA synthesis inhibitors and map our knowledge to images for easy recollection. The specific class of drugs we'll focus on are quinolones, nitroimidazole, and sulfonamides. Let's discuss the quinolones. Queen rhymes with quinolones. The queen in this picture should help you associate this image with the pharmacology of quinolones as new DNA synthesis inhibitors. If you notice, the queen is wearing a sash with the letters Na inscribed on it. This is to help you remember that they are synthetic antibiotics that are chemically related to nalidixic acid. A novel group of quinolones were synthesized with the addition of a fluorine functional group at the 6th position of the quinolone nucleus. Flower sounds like fluoro. The flowers on the queen's laps should help you remember the fluoroquinolones. Classification of quinolones. In the coming scenes, we journey through time and space to explore the 4 generations of quinolones. Each scene represents a different level of sophistication, reflecting the advancement of these antibiotics through the years. Our journey begins in the medieval marketplace, symbolizing the 1st generation of quinolones. This older and simpler setting reflects the initial development stage of these antibiotics. In this scene, we see the brave knight Nali holding a shield adorned with a laurel wreath. Nearby, an ox wears a similar wreath necklace, representing oxalic acid. In the background, a cinema marquee brightly displays the name Synoxacin, highlighting the 2nd member of this initial group. If we zoom in on the ox, we see the 10 rings on its horns. Dix is French for 10. This, together with Nali, should help you remember nalidixic acid as a drug in this class. We now proceed to a castle courtyard scene to illustrate the 2nd generation quinolones. In this scene, a bright northern star shining in the sky, symbolizing norfloxacin. A tall cypress tree stands proudly representing ciprofloxacin. In the center, a dancer with a flowing dress twirls gracefully, embodying danafloxacin. Nearby, 2 identical jesters playfully entertain the crowd, signifying defloxacin. An eagle perched on a central fountain symbolizes enoxacin. The fountain should be overflowing with water, representing the increased bioavailability and tissue distribution of the 2nd generation agents. This lush royal garden scene represents the 3rd generation of quinolones. At the heart of the garden, the orb on a pedestal symbolizes orbifloxacin. The magician, levitating effortlessly, illustrates levofloxacin. A sparrow flies through the lush greenery, embodying sparfloxacin. The diligent gardener tending to a grapevine represents grepafloxacin. The garden, beautifully landscaped with healthy, thriving plants, should represent excellent bioavailability. The clock with 2 long hands, symbolizing a longer elimination half-life. And finally, the serene, toxin-free zone represents less CNS toxicity and less CYP450 interaction. In the background, a broken DNA helix statue to represent the inhibition of DNA gyrase synthesis and subsequent protein synthesis inhibition. In the next scene, we will continue with the 4th generation quinolones. This grand banquet hall scene represents the 4th generation of quinolones. The treasure chest on the lavish banquet table symbolizes trovafloxacin. At the head of the table, a regal cat lounges on the throne, representing gatafloxacin. Overhead, a mockingbird is perched on a chandelier, illustrating moxifloxacin. The gem-encrusted goblet on the table shining brightly to signify gemafloxacin. Finally, the king is holding a scepter, representing cetafloxacin. Next, we'll discuss the antibacterial spectrum of the different generation of quinolones. In this detailed scene in a microbiology laboratory, we illustrate the antibacterial spectrum of quinolones across 3 generations. Starting with Knight Nal, who represents the 1st generation of quinolones. Knight Nal has on a red cape to symbolize the limited effectiveness of the 1st generation against E. coli and some gram-negative organisms, with a red collar, reinforcing the focus on E. coli. Collar sounds like coli, so it will remain a recurring symbol for similar representations. Next, in the center of the scene, a graceful dancer with a flowing dress represents the 2nd generation of quinolones as seen in a previous image. She is wearing a white dress and a white collar locket to symbolize the increased effectiveness against E. coli and some gram-positive organisms. To the right, include a levitating magician with a serene expression to represent the 3rd generation of quinolones. the magician has on a blue collar to indicate balanced activity against both gram-positive and gram-negative organisms. In his palm, he holds a small levitating white orb to symbolize gram-positive Coxy being round like an orb. Additionally, the gust of wind swirl around him, and the dancer, symbolizing the action against P. aeruginosa. At the corner of the laboratory, in the background behind the magician, a clock with long hands symbolizes the longer elimination half-life of the third-generation quinolones. The surface of the clock covered with bacteria to represent mycobacteria. Additionally, the clam beside the clock symbolizes chlamydia. Back to the previous image, the shadow figure around the levitating magician represents anaerobes, and a faint mist around the orb symbolizes mycoplasma. Thus, third-generation agents have increased activity against E. coli, P. aeruginosa, mycoplasma, chlamydia, G-positive coc, anaerobes, and mycobacteria. Next, we'll discuss the clinical uses of quinolones. Each aspect of this image is key in illustrating the clinical uses of this class of drugs. Commonly used agents include ciprofloxacin, as symbolized by the cypress tree in the image, levofloxacin, symbolized by the levitating magician, norfloxacin, symbolized by the northern star in the sky, and ofloxacin, symbolized by the O symbol in the sky. These drugs are used in the treatment of UTIs. As shown in the image, the magician has fluid dripping from his cloak to the floor, and it looks like he wet himself. He has both hands on his abdomen and looks like he's in terrible pain. The water drip represents the drug's significance in treating urinary tract infections. The hand on the abdomen, together with the painful expression, represents the use of this drug in treating illnesses associated with organs in this region: prostatitis, GI infections, and soft tissue infections. If you pay close attention to the sky, you will see a acute pi symbol. Acute pi sounds nearly the same as acute pyelonephritis. This should help you remember that these drugs are used to treat acute pyelonephritis. The fire symbol on the magician's pants around the crotch area is symbolic for their usefulness in treating epididymitis. At a far distance in the woods, this young boy stands watching the magician perform. The drool over his nose and mouth represents the use of these drugs in the treatment of respiratory and ENT infections, such as bronchitis, pneumonia, sinusitis. At the center of the scene, we see a majestic but troubled queen, representing quinolones. Her attire and surroundings tell a story of various adverse effects associated with these medications. To the right, we have a levitating magician. His cloak collar is engulfed in flames. His cloak is a covering for his body and can be likened to a membrane. Collar sounds like coli. Together, these two symbolizes pseudomembraneous colitis. He grimaces in pain and is vomiting, clearly suffering from nausea and vomiting. Next, focus on the queen herself. She wears a crown, yet her robes are tattered from the chaotic events, embodying neurotoxicity and psychosis. She has her eyes closed, indicating photosensitivity reactions, protecting herself from the bright lightning caused by the magician's loss of control, symbolizing seizures. Notice the red rash all over her skin, representing an allergic reaction. Her overall disposition suggests psychosis, further emphasizing the mental effects. Finally, next to the magician, a guard is sitting in a wheelchair. This represents the musculoskeletal effects of quinolones, such as cartilage and tendon damage. A warning sign nearby cautions that quinolones are contraindicated in pregnancy and children due to these effects. Through this scene, we vividly depict the complex adverse effects of quinolones, making them easier to remember. Other contraindications include epilepsy, stroke, CKD, QT prolongation. Thank you for watching. Please like and subscribe.